Did you know you can naturally reverse a cavity without a filling? In this video, I want to tell you the story of two people who chose to do that. I want to tell you a story about a lady who contacted me about 4 months ago. She'd had a dental appointment, and when they took x-rays, they had found a hole in her tooth, a lower canine tooth, which is an unusual place for a hole. She had found me online. She hadn't tried the system that I recommend yet, but we finally got her organized and she started using xylitol and my complete mouth care system in an effort to avoid having a filling in that tooth. Now, the reason you would want to avoid a filling is kind of twofold. First of all, if you don't remove the cavity infection, if you don't remove the reason why you have a cavity, then that infection, that plaque-forming, acidic, cavity-forming infection will remain in your mouth. People don't understand that. They think a filling is taking away the problem. It doesn't. It fills the hole. The disease, the bacteria that actually cause the cavity are still in your mouth, and they take 6 months of adequate care. And I recommend a strategy using xylitol at intervals throughout the day so that you gradually eliminate over 6 months any risk of this plaque-forming, cavity-forming, acid-forming bacteria doing any more damage. The problem today is people have fillings done, and then 13, 15 years later, that filling needs replacement. They think the filling aged. No, the filling doesn't age. What happens is they form plaque magnets. They actually attract plaque to the edges of the filling. And what happens over a period of 10 or so years, the edges of the filling will deteriorate. And then the decay will go underneath the filling. And when you have that replaced or redone, the filling gets bigger and bigger. Each time that filling is replaced, you're losing more and more tooth substance. Instead of going down that road, this lady chose to use my complete mouth care system and stop the disease. The thing was, she had only been 4 months since her diagnosis. How long does a cavity take to form? Looking at the x-ray, I would recommend that it was quite likely something in the region of 8 years that cavity had been forming. It doesn't happen quickly. Cavities don't form just in 2 or 3 months. If they are, they're very superficial, and if you use my complete mouth care system, they should disappear in a similarly short period of time. If you have a hole or an area that looks like a hole on x-ray that is quite substantial and into the dentin, the chances are that that has been occurring, has been happening slowly and progressively for many, many years. Looking at her cavity, my guess would be it had been there for maybe up to 8 years forming. That's not going to go away in a quick 4 months. She'll have some benefits, but she hasn't even got rid of the plaque from her saliva at this time. She went back for a dental cleaning, a revisit. They took new x-ray. And she contacted me very upset that my system wasn't working. Her cavity was still there. In fact, she thought it was worse. I looked at the x-ray and explained that the x-ray's been taken from a different angle. Unless you take the x-ray from the same angle, it's like a photograph. You can take a photograph from a different angle and make your nose look longer or shorter. And there's all sorts of tricks that photographers do. And it's the same thing with a dental x-ray. If you don't take it exactly the same angle, it's very hard to compare one x-ray taken 4 months ago with the one taken this week. And in actual fact, I believed that the enamel, the actual coating on the outside of that tooth, if she looked carefully, it looked more mineralized. You see, an x-ray simply tells you, like a black and white photograph, how many minerals are you looking at. The x-rays bounce off the minerals in your teeth, and the x-ray shows white because none of the x-rays go through highly mineralized areas. They bounce off, and the photograph or the x-ray appears white. Where there are no minerals or few minerals means that the x-rays will go through that area of the photograph or the x-ray, and it will appear darker. You see, even this hole that looks black on x-ray, when your dentist holds up the x-ray, shows you this black hole, it may not be a hole at all. It's simply an area where there is no mineralized, that area is not fully mineralized. It doesn't have the packing of minerals that it should have. And when you use good techniques to heal, to repair, to remineralize this area, those minerals will go into the tooth and redeposit. Now, it takes time. Have you ever had a broken arm and had your arm taken out of a cast and they x-ray it? And you go, gosh, you're taking me out of the cast and it doesn't look connected. That's because at first every doctor will know that there is collagen forms. So your bone is quite firm, but it isn't fully mineralized. That takes 3 to 6 months before you'll see those minerals so that the x-rays are bouncing off that newly mineralized bone, in this case, tooth. My encouragement to the lady was to continue. It's too soon. But just look at the enamel. Your enamel, the coating over the outside of your tooth, compare this x-ray with the one you had taken 4 months ago. And you will see it's brighter, it's whiter. That means it's got more minerals in it. That is a wonderful thing. And when a cavity heals, the first thing you want is to, first of all, feel that your mouth is feeling cleaner. That means that plaque, sticky stuff is not forming on your teeth. The next thing that will happen is your enamel should feel smoother, shinier. It should look maybe whiter even to your eye as you look in the mirror. And in an x-ray, it will bounce the minerals, will bounce the x-rays off, and it will appear brighter, whiter than it did in the previous x-ray. Then, once the enamel seals over the cavity area completely, that is when the mineralization occurs inside, in this deeper part of the cavity. Dentists will say it never occurs, and I will say that it does occur. And the reason it occurs when you use my system, my strategy, is that the reason in the old days that cavities didn't mineralize deeper was that they never got rid of the problematic bacteria. You see, within the cavity initially are problematic acid-forming bacteria just dying to eat away at your tooth. If you are consistently feeding them small amounts of xylitol by consuming a little xylitol at the end of every meal, that xylitol will be literally sucked in by those bacteria, thinking it's their food. And instead of feeding them, it will actually feed them, but by feeding them xylitol, they will be inactivated. They cannot use it, they cannot process it, they cannot multiply. When they don't multiply, they don't form acids. And when they don't form acids, they will die off, and that will allow the natural remineralization process to occur. And once you have sealed the outside of a tooth with the stronger mineralized enamel, that will then allow the inside cells inside the dentin to put minerals back into this deeper area. And if you have a young dentist who's telling you that doesn't happen, again, does he understand or she understand, maybe they were never taught, that dentin is cellular. Throughout the tubules of dentin are the extension from the cell which secretes, it actually produces new dentin. This is fed by the cells on the inside of your tooth. I would highly recommend the gum massage, which creates circulation and lymphatic drainage in the areas around your teeth, because the inside of your teeth are full of liquids, minerals, there is blood flow, there are cells inside your teeth. We really haven't fully realized how important they are in the healing process. But I believe they are important, so you need to brush your gums around that healing tooth area and you need to be using my complete mouth care system. And ideally, on top of that, the kind of icing on the cake is to eat a diet that supports this healing. Make sure that you're eating a healthy diet, as healthy as possible, with plenty of vitamins K, A, C, all the things, calcium, phosphate, all the things you need for skin and bone healing would be a very good kind of diet to be eating while you are waiting for your cavity to heal. This lady actually did ask me, her dentist had suggested putting silver diamine fluoride on this cavity. And I was frantically telling her, no, do not do that to an adult tooth, because that is an artificial way of stopping the cavity, but you will stop the healing at the same time. Silver diamine fluoride, SDF, is very useful to stop a cavity on a baby tooth. I do not recommend it for an adult tooth that is trying to heal itself. I simply encouraged her to keep going. That 4 months is not long enough. Why don't you go back in the next 6 to 8 months, and then let's take another x-ray and see what's happened then. So some years ago, a hygienist friend of mine, actually here in Austin, her son, who was a sea captain, was going away to sea for 2 years. And as a good hygienist mom, she took him into the office, took the bite wing x-rays that most dentists take all the time, every time you have a cleaning, and she cleaned up his teeth and then looked at the x-rays and was astounded. He had 15 cavities in between all of his molar teeth, everywhere around his mouth, into the dentin. Dentists who are listening to this, these cavities were right into the dentin, which from a dental perspective, from her perspective, meant that these, if they were not treated quickly, would end up as root canals, killing all these teeth in her son's mouth. He was leaving the next day. There was absolutely no time for the treatment. She knew me. She knew about the complete mouth care system that I had said many, many times was so effective. If used the way that I suggest, she or he would be able in this situation to stop the disease and reverse it to some degree. The degree to which it can reverse, I cannot guarantee. Everybody is different. They have different healing patterns. But by using the complete mouth care system that I recommend, I was confident he would stop the disease where it was, and it was not causing pain, and that for 2 years he would see some degree of reversal. So he went off to sea, and she sent him the equipment he needed, the products he needed, so that he was fulfilled with everything he needed for the 2 years that he was at sea and away and unable to have any dental treatments. When he came back, as a good mother, good hygienist, she took him straight into the office so that he had plenty of vacation time to embark on all the fillings and crowns and root canals she was afraid he might need. The x-rays were taken. All 15 cavities had reversed. Now, they had reversed because they had had adequate time. What I think most often happens, the panic sets in. The dentist looks at the patient, is concerned. She would have filled these teeth because she was trained to fill them. If there is no pain, if there is a good, effective strategy, you're on my complete mouth care system, please don't just leave your fillings unfilled. It requires xylitol, it requires a really good strategy. But using that strategy can, if you give it time, help you to either reverse or completely reverse many, many cavities so that you can avoid fillings.